Hello everyone, I am Dr. Minny Jain. I am consultant psychiatrist at Aakash Medical Centre. Today I am going to clear few of the myths and concerns related to depression. First of all, let's understand what is depression. As nowadays we commonly use this term, like whenever we feel low or we are irritated, we call that we are going through depression. But it is not so. Depression is a complex disorder which has a biological, psychological, and socio-economic component linked to it. When I say it has biological components, I mean it has a role of multiple neurotransmitters in our brain, especially serotonin. Serotonin is a very important neurotransmitter which helps in our mood, in our memory formation, in our sleep cycle. So, in depression, when there is low serotonin, this leads to the symptoms of depression. The major symptoms of depression are low mood, irritability, anhedonia, which means like a person is not able to enjoy the activities which he or she previously used to, and associated with lethargy, body complaints, body issues. Also, there are disturbances in the sleep, appetite, and there can be ideas of suicide, pessimistic thoughts, ideas of helplessness, worthlessness, hopelessness associated with it. When all these symptoms, at least two of the major symptoms associated with few of the minor symptoms, when they are persistent for at least 2 weeks, then we say, okay, that the person is undergoing depression. Why is it important for us to talk about this? Because today, like if I say the current statistics, according to the recent WHO reports, around 40 to 45% of the people, they get diagnosed with depression. Out of those, most of them are in the category of mild to moderate. Few 2 to 3% out of them are in the category of the severe depression. When it comes to severe depression, it has suicidal tendencies related to it. It has very pessimistic thoughts about the future. The person is hopeless, the person does not know what to do, and might require hospitalization as well. Also, not only in the general adult population, but depression is nowadays very common in the children and adolescent population as well, which constitute around 2 to 3% prevalence rate, and which is on the increase also. Around 20% of the people who are in the elderly population, they suffer from depression. Not only this, but people who have multiple chronic diseases, for example diabetes, hypertension, cancer, they also suffer from depression, and quite a good number of out of those people suffer from depression. One another major category which comes under depression is the postpartum depression. Around 20 to 30% of the females who have delivered a child, they have a tendency to undergo postpartum blues and then depression also. So that is why it is very important to discuss about depression. This disease per se is very disabling. A person is not able to perform in the desired roles in life. So, if you, how can you identify depressive symptoms in your loved ones? If you see like either your children, adolescent age group people, or young adults, or any other person who recently showing a change in behavior, like they are not interacting much with other people, they like to remain confined to a room or space, not interacting with other people, there are significant sleep disturbances, there are significant appetite disturbances, and the person talks about suicidal thoughts or talk about dying all the time, and is very negative and pessimistic, his or her performance at school or maybe job is continuously declining, then yes, you should be worried about it. The person might be undergoing depression. Nowadays, with the advanced scientific technology, the depression is very much treatable just by help of few medications and a number of therapies which are available, counselings which are available for a person to avail, with which a person can easily come out of depression. There are many misconceptions related to psychiatric medications. many people have a notion that they make you very drowsy, very sedated, and you're not able to do any work. And in long term, the person gets addicted to it. But let me tell you, there are the most of the medicines, and nowadays there are many latest medicines which are coming up who do not have such side effects. They don't make you drowsy. They don't make you addict to something. So there are number of options which are available, and also there are number of therapies: cognitive behavior therapy, supportive therapy, art based therapy, number of options available which you can choose according to your convenience. In the end, just to summarize, I would like to say that depression is very much disabling, and it is of concern, and it is easily treatable. So please, if you have anyone you know who is going through depressive features, or you yourself or your family members are facing through that, please consult a mental health expert and take their advice. Thank you.